Good afternoon, everyone. Thank you for joining us again today. I will start with the usual update on the COVID-19 statistics for Scotland. I can report today that an additional 12 positive cases were confirmed yesterday, and that takes the total now in Scotland to 18,276. A total of 670 patients are currently in hospital with suspected or confirmed cases of the virus, and that is 115 fewer than yesterday, and it includes a reduction of 10 in the number of confirmed cases. A total of 12 people last night were in intensive care with either confirmed or suspected COVID, and that is 3 more than the figure yesterday. Since the 5th of March, a total of 4,088 patients who had tested positive and been admitted to hospital have now been able to leave hospital. In the past 24 hours, though, I can confirm that 1 death has been registered of a patient confirmed through a test as having the virus, and that takes the total number of deaths in Scotland under that measurement to 2,488. We must, of course, always remember that each and every death in Scotland and anywhere, of course, is a source of grief and heartbreak. And once again today, I want to send my condolences and wishes to everyone who has lost a loved one to this illness. I also want today not just to say my usual thank you to health and care staff, but an extra special thank you to everybody working across our NHS and social care service. This Sunday sees the 72nd anniversary of the creation of NHS Scotland in 1948. In the same year, the National Assistance Act, which laid the foundations for social care in our country, was also passed. Now, we're grateful to those working in health and care services every single year, but there's no doubt at all that our health and care workers have been challenged over the past period like seldom before in that 72-year history, and they have responded absolutely magnificently. So my thanks once again go to each and every one of them. It is not possible to find the words to sum up the gratitude that I feel, and I know that gratitude is shared by everyone across our country. We are all grateful for everything you have done and continue to do. Now, I've just got a couple of things I want to speak to you about during this update before I hand over to Professor Leitch and then to the Economy Secretary. The first thing I want to touch on is something you will be watching in the news today, and that is the issue of air bridges. As you know, the UK government has announced a list of countries that it intends to remove from quarantine restrictions in relation to travel to England from the 10th of July. Now, I explained yesterday some of the reasons why it has been really quite challenging for Scotland to come to a position on the UK's proposals with any speed. We've often had limited or no notice of the UK's proposals, and that matters because some of the judgments involved here are difficult and complex. And just to illustrate the point about the shifting sands of the UK government's position, the list of countries that they were yesterday demanding that the Scottish Government signed up to and suggesting that we were a barrier to getting agreement on is not the same as the list that they have shared with us today. So we need, as the Scottish Government, to analyse these proposals properly and rationally. And we need to do that, obviously, from a public health perspective, but we also need to do that from a legal perspective. All of these decisions are, of course, potentially open to legal challenge. And when so much is at stake, as it is right now, we can't allow ourselves to be dragged along in the wake of another government's, to be quite frank about it, shambolic decision-making process. So we will take time to properly and rationally consider this before, hopefully very soon, setting out our own decision. And I want to just briefly share with you why it's important to take care because of the complexity of the issues that we're dealing with. The first thing I want to make clear, just in case there's any doubt, I hope there's not, but let me be absolutely unequivocal about this. We want to welcome visitors again from around the world, and of course we also want to allow our own citizens to travel. That's important for our tourism sector, it's important for our aviation sector, and it's important for our economy generally. And Scotland has a long-standing reputation, and one that I hope will go well into the future, of being an open and welcoming country. And we also want, if possible, for obvious practical reasons, to have alignment on these matters with the rest of the UK. But, and I hope this is a point that everybody can understand, we must make sure we open our country up again safely, and we absolutely must make sure that the decisions we take don't put at risk the progress that we have made in tackling COVID, because that progress is significant, as you know, but it has also been very, very hard earned, and it's important that we protect it in the weeks ahead. And the fact is that measures such as quarantine, they become arguably more important, not less, as levels of the virus here in Scotland reduce. And that's because when there are low levels of the virus here, one of the key risks we have to manage, and it's one of the key risks that people like Jason Leitch will advise me that we have to be very careful in our management of, is the possibility of new cases of the virus coming into Scotland from outside. And that risk is, of course, greater when people might be coming to Scotland from countries where the virus is still more prevalent than it now is here at home. And while we do want an alignment with the UK, because as I said a moment ago, the practical reasons for that are obvious, an added factor we have to consider is that we are not dealing with a uniform picture across the UK when it comes to the level of COVID infection. For example, we assess that the prevalence of the virus in Scotland right now is 5 times lower than it is in England, and Northern Ireland actually faces a similar issue. So that means that there may well be cases where the UK government is admitting visitors to England without quarantine from countries that don't present a significant risk of raising infection levels there, but would create that risk in Scotland. Now, none of this is easy, and it is really important that we make sure that we consider all of these issues carefully, and that we're not taking any of these issues in a careless way. Because they are complex, and the consequences of the decisions we take could be significant. You know, there's a in my view, not entirely unreasonable school of thought that travel restrictions should have been imposed for the UK earlier in this pandemic. Now, others will take a different view on that, and there is a debate about the rights and wrongs of it. But the fact that we do debate that, I think, underlines the importance of not taking ill-thought through decisions now. So we will consider this issue carefully. I think I can say now that it is likely, very likely, that we will be able to agree the list of countries that the UK has categorised as low risk, although we will need to do a proper assessment of that. But we need to take some particular care in our assessment of the list of countries that are being categorised as medium risk, because that is where there may be some countries that have a higher prevalence of the virus than Scotland does right now. Now, we will hopefully conclude that process of consideration over the next couple of days and announce our decisions on that quickly. But I wanted to take just a minute or two to set out the reasons why we are not immediately agreeing the list of countries that the UK government has proposed, and the reasons why it is so important that we take these decisions carefully. And in the meantime, this will be my last point on this issue. In the meantime, if you're desperate to book a summer holiday, and if you are, that would be entirely understandable, why not think about booking it in Scotland this year and giving some support to our own tourism sector at a time when they have probably never needed that support more. Now, the second issue I want to briefly cover relates to the economy. Fiona Hyslop will speak in a moment about support for business, including tourism, and also for performing arts venues. Today, though, also sees the publication of a report from a subgroup of our Enterprise and Skills Board about the impact of COVID on jobs and skills. The group has made some significant recommendations on keeping unemployment to a minimum as the economic impact of this crisis continues. These recommendations include supporting the retention of as many workers as possible, helping especially vulnerable groups, providing more effective assistance for people who are facing redundancy, and maximising the flexibility of colleges and universities. We'll consider these carefully alongside last week's report from the advisory group on economic recovery. But I wanted today just to confirm one announcement in relation to one of the recommendations. The proposal from the advisory group to implement a job guarantee for young people fits well with many of the key priorities identified in today's report. So I can confirm today that Sandy Begbie, who is the Chief Transformation Officer of Tesco Bank, has agreed to lead the work on developing an implementation plan for a job guarantee. Sandy has valuable experience in this area. He was very closely involved in the Edinburgh Guarantee for Young People and in our Developing the Young Workforce programme. Together, today's report and the Advisory Group on Economic Recovery have highlighted important ways to support skills and employment despite the heavy impact that COVID is having. And the Scottish Government is determined to do that, and in so doing we will work with business, the public sector, trade unions and many others as we continue to turn plans and proposals into firm actions. Now, the final issue I just want to highlight is that today sees the lifting of the 5-mile limit travel guidance, except of course for some parts of Dumfries and Galloway, and Professor Leitch will give an update on the Dumfries and Galloway outbreak in a moment. Outside of Dumfries and Galloway, the postcodes we spoke about yesterday, which are listed on the Scottish Government's website, we are no longer outside of those areas recommending that you must stick to a 5-mile travel limit for recreational purposes. I'm sure many of you will be thinking of taking advantage of that to travel a bit further over the weekend, and that is great. I hope you enjoy seeing some more of Scotland again and supporting local businesses as you go. But please be careful. New guidance has been published today on the Transport Scotland website, and I would recommend that you take time to read it. As you travel, avoid crowded places. If you go somewhere and it's already busy, go somewhere else, and make sure you don't leave litter behind. And please be sensitive to people living in our rural and island communities, because if you don't take appropriate care, you run the risk of taking the virus to these places, and nobody wants to see that happen. As we do get aspects of normality back into our lives, although life still shouldn't feel completely normal right now, but as we get aspects of normality back, the question we should all be asking ourselves is, how do we make normal safe? And in many ways, that message is the note I want to end on. Because as we all start going out and about and doing more, it's important that we all comply with, rigorously, to the letter, the health advice that we have been circulating. So I want to end with a reminder for you of the FACTS campaign, the 5 things all of us should do to try to make normal, as we slowly get it back, safe for ourselves and everybody else. So face coverings in enclosed spaces like shops and public transport, avoid crowded places, clean your hands and hard surfaces carefully and regularly, 2-metre distancing remains the rule, and self-isolate and book a test if you have symptoms. If we all comply with these 5 measures, then we will keep ourselves safe, we will protect others, and ultimately we will save lives. So my thank you to every one of you for cooperating with that and abiding by the advice. I'm now going to hand over to Jason Leitch, who will, amongst other things, I'm sure, give an update on Dumfries and Galloway, and then I'll hand over to the Economy Secretary before we move on to questions as usual.
Thank you, First Minister. 2 things from me today: the Dumfries and Galloway and Cumbria outbreak, and then a little more on the 72nd anniversary of the National Health Service and how you can personally get involved in that. So, as you saw yesterday and the day before, we continue to manage a Dumfries and Galloway and Cumbria outbreak of COVID-19. There are now 11 positive cases in that outbreak. It's important to understand that the new positive in the last 24 hours is not connected to the other households in this outbreak in any way, but has an independent connection to the Carlisle Hospital. So in that sense, we're counting it as one outbreak across both of the jurisdictions. We're reaching out to all the staff from the hospital who live in Dumfries and Galloway with a Scottish residential postcode, and are offering them anything they need in terms of testing, if that's appropriate, and other support if they wish to speak to us. There are 23 contacts presently in our contact tracing system. They have all been spoken to, they have all been offered testing, and they have all been told to self-isolate. We believe they are all self-isolating. At this point, and it's a little bit early to say, at this point, we believe that is the end of the contact tracing. But we can never be absolutely sure. It's not an exact science. We've always said from this podium and others that you can't really be sure that you've reached the end of the viral transmission chain. But so far, the public health leads and the public have done a fantastic job in controlling this outbreak. But we may be back next week telling you that that's no longer the case, of course. The testing is complete at the 2 Alpha Solway factories we mentioned yesterday. We will get the results of them mostly today. And the second day of testing is ongoing today at the Youngs factory. Remember, there is no suggestion these outbreaks either began in these institutions or have spread in these institutions. There is just a contact connection to these institutions, and therefore we're treating them as higher risk and taking a precautionary approach to testing. I've spoken again to the Director of Public Health from Dumfries and Galloway today, and there will be another incident management team today at 4 o'clock, and we will keep the First Minister and the Cabinet Secretary informed of any progress. Just let me take a moment to thank those who have been involved in this. A large team in Dumfries and Galloway, in Cumbrian Public Health, and across Dumfries and Galloway's public. Thank you for everything you've done to manage this outbreak the way you have so far. It underlines the nature of this virus, and the First Minister has touched on this, and how careful we have to be and continue to be. Controlling this virus is hard. It is not easy. And I don't want to blame any single individual, but outbreaks are often because the virus has been given opportunity to jump between households. You've heard us talk a lot about breaking the chain of the virus. Well, this is what happens if you allow the virus to jump. And it goes from household to household very, very easily. 11 people now have this disease, and I don't know, but some of them could get seriously unwell. This virus is not to be trifled with. Do not underestimate the illness this virus causes. The way you can stop that is following the facts that you've just heard from the First Minister, particularly the physical distancing. If you come close to people, you will be at risk of the virus jumping across, but also face coverings, hand washing, cleaning surfaces, and everything else you know so well. Perhaps on a slightly more upbeat note, let me just very briefly say something about the 72nd anniversary of the National Health Service. Over the last 4 months, the NHS and our wider health and social care services have adapted at a phenomenal speed and scale to meet the challenges of this pandemic. It's important that we celebrate these anniversaries each year, but this year feels more important than ever. Buildings across the United Kingdom on Saturday night will light up blue. Please look out for that if you can see them through what I anticipate being quite a rainy evening if the forecast is correct. And during the early stages of this pandemic, we demonstrated our appreciation for health and care staff and other key workers with the Clap for Heroes on Thursday evenings. So on Sunday evening at 5 o'clock, we want to have the biggest and loudest clap yet across the whole of the UK. But we want Scotland's clap to be louder than everybody else's. All around the country, we will be able to show our support. Please join in the celebration by taking part in that very special Clap for Heroes, and perhaps share your photographs or your thoughts or your celebration on social media using the hashtag #NHSScot72. Thank you.
Many thanks, Jason. And finally, before questions, I'll hand over to Fiona Hyslop.
Thank you, First Minister. We are now taking significant steps to the reopening of our economy, and we are starting to make real progress in safely restarting a range of key sectors. Self-contained, self-catering holiday accommodation across the country is now able to reopen. Non-essential retail opened from the 29th of June, providing a welcome opportunity to support our local economies and those businesses that have been closed by shopping locally. The Scottish Government is supporting the cause by running a Shop Local Safely campaign in newspapers across Scotland. We want to support our town centres as we recognise the contribution that they make. We are doing this through our £2 million Towns and Business Improvement Districts Resilience and Recovery Fund, which builds on the £1 million already committed to this important work. However, we're acutely aware that not all sectors are yet able to make that same progress. That is why today I am announcing a further targeted £10 million Performing Arts Venues Relief Fund. Our theatres and performing arts venues and the talented freelancers who work with them are an essential part of the fabric of Scotland's culture and communities and promote our international reputation. And we are determined that they will survive and thrive, and we want to support them. This new dedicated £10 million fund for theatres and other venues and freelancers who work with them is part of our £2.3 billion package, delivering on our commitment to get every penny of consequentials out to businesses and organisations in need, and will help those performing arts venues who cannot yet reopen to their audiences. The fund will be run by Creative Scotland, who will publish full details shortly. This is a sector that has been severely affected by the crisis, with many left with no choice but to close at short notice and with an almost complete loss of income overnight. I'm incredibly grateful to them for doing so. They have undoubtedly saved lives. But I know the financial impact has been severe, not just for the venues, but also for the freelancers who work alongside them. This dedicated fund will be a vital lifeline. It builds on help we have already given to culture and the creative industries, including through the £120 million Pivotal Enterprise Resilience Fund. On April the 30th, we launched the £34 million newly self-employed hardship fund to provide relief to newly self-employed individuals who've lost revenue to COVID-19. This plugged a gap in existing support as the UK government scheme was inaccessible to people who have become self-employed since April 2019. In response to calls from business and to give further support to our tourism industry, we also repurposed £3 million of this fund to support bed and breakfast and other small serviced accommodation. I can confirm today that the small B&B fund, which is part of the £185 million business support, will be extended to cover those with a business account who have received no grant to date. The small B&B and the newly self-employed hardship funds both remain open to new applicants until the 10th of July. So it's clear that we are making a number of positive steps towards Scotland's economy reopening, but as I said at this briefing last week, all these changes and continuing with the progress we have made to date depends entirely on the continued suppression of the virus. Therefore, we must all continue to work together to ensure the continued safe reopening of Scotland's economy.
Many thanks, Fiona. I will move now straight to questions. The first question today is from Nick Sheridan from BBC Scotland.
Good afternoon, First Minister. Even if you don't decide on an identical list to the UK government on low-risk countries, due to the lack of checks at the border, doesn't that mean that anybody who is flying into England can travel quarantine-free into Scotland? And secondly, the Transport Secretary, Grant Shapps, says that the Joint Biosecurity Centre, which drew up this list from the UK government, includes the Scottish Chief Medical Officer. So if you weren't getting the information that you wanted from the UK government, why didn't you just ask the Scottish CMO?
Okay, there's a couple of points in there that you've given me the opportunity to correct, so I'll take those opportunities. On the point which is, I think, a misconception, is that if there was, and I'm being hypothetical now because I don't know, and we will try to maximise alignment as much as possible, but if there ends up being a different list of countries that are able to come in to England without quarantine from the list that the Scottish Government agrees, it will not be the case that somebody can fly into England, to an airport in England, and come to Scotland without quarantine. The quarantine regulations in Scotland will mean that if you come from an international country and come back to Scotland, even if you're coming through England, you will still have that requirement to quarantine in Scotland. So let me be very clear about that. I think there's perhaps a bit of a misunderstanding of the Joint Biosecurity Centre. We're still having discussions about the formal role that the Scottish Government will have with that. We want, again, to be a full participant in that, but there are governance issues that are still being worked out. The four CMOs, and the Scottish CMO was here yesterday and referred to the fact that the four CMOs had a discussion yesterday about this and decided that further work had to be done. I am not aware that that work has been completed yet, and therefore that is another reason why we have to take a careful approach to decision making here. But a more fundamental point here is that if there had been a list of countries that had basically remained constant for the last few days and that we had a fixed proposal to consider, then some of these questions would be more legitimate. But literally, the proposal from the United Kingdom government has changed on a daily basis. I reflected yesterday in response, I think, to your question, Nick, that the Four Nations call that had taken place on Wednesday, if I'm getting my days right here, with Hamza Yousaf from the Scottish Government, we went into that call expecting to discuss one list, and it changed half an hour before the call happened. And then it changed again after the call had happened. And when I was talking to you yesterday and responding to allegations that I and my government were a block on an agreement to a list, the list that I was talking about yesterday is not the same one the UK government has shared with us today, or the one that I think they will be publishing today. So it has been a shifting position, which has made it very hard for us to apply proper assessment. Now, hopefully the position today is the one that we can now properly assess, taking into account all of the information and evidence, including, of course, the advice of our Chief Medical Officer that we require to do. And let me be clear here. I want travel to be as free as possible. I want there to be as much alignment with the UK as possible. That obviously makes sense. But I am not prepared to take careless decisions that put at risk the progress against this virus that all of you have made. And I think you should be angry at me if I ever do that. So I will be attempt to be very rational in decision making here. We would be making a big mistake if we allowed or took too high a risk of allowing the virus to come into Scotland from elsewhere, having made such progress in suppressing it. So rational decision making is maybe not as fashionable across all governments as it once was, but I still think from a Scottish Government perspective, rationality is quite a good principle to try to adhere to. Louise Scott from STV.
Thank you. Just to pick up a little bit on Nick's point there, to do with the air bridges, for those holidaymakers, we've heard of some Scots holidaymakers this morning already booking holidays to destinations in Europe, for example, from English airports. You're saying that, for instance, that country doesn't end up being on the list of places that is safe to fly from Scotland, that they will still have to quarantine. But how will that work for them coming into an English airport? How will they, I guess, be made aware that they would have to quarantine? And also, we're also hearing of concerns that the announcement today is really going to deter tourists possibly over the summer coming to Scotland, feeling that it's not safe enough even when it does open up. How will you ensure that that won't happen to an industry that's already struggling?
I will do everything I can to support the tourist industry here, and we can all try to support the tourist industry here. But aside from the substance of the issue I'm about to address again here today, is the fact that we can all choose, if we so wish, and if we've got the wherewithal to do it, to support our tourist industry directly, about maybe choosing in a way that we might not do every summer if we want to go abroad to holiday here in Scotland. And that is helping our tourist industry. So, where possible, think about having a staycation this year and help the tourist industry here along the way. Now, in terms of, I don't want to put off tourism, but I want to keep Scotland safe from a deadly and dangerous virus. And I have faced criticism, which I don't think is illegitimate, to face scrutiny and criticism around these things, about should we have been stricter about incoming travel at an earlier stage of this pandemic. If you remember a few weeks ago when we were talking about the genomic sequencing and the numbers of importations of the virus into Scotland. Now, we can debate whether the rights and wrongs of that, but we are now at a stage where we have been very successful at this stage of suppressing the virus in Scotland. So we have to be very thoughtful and mindful about decisions we take that could lead to the virus coming in again. Now, I know that's not easy, and I know that can be inconvenient for people who want to travel, but that's my duty, to try to open up the economy, to balance all of the different factors that we're dealing with right now, but fundamentally not to squander the progress that we've all managed to make together over these last 3, almost 4 months, because that would be such a heartbreaking thing to do. So that's why I've got to be careful in taking these decisions. And the last part of your question, how will people know? Just let me be clear, the quarantine, if you come into England from another country and come to Scotland, the quarantine regulations whatever they will be at that time, and we haven't taken decisions right now, will still apply. And how will people know? Because I'm telling people that and wanting people to be very clear about that. So we will come to a decision on these issues as soon as we can, as soon as we've done all of the assessment that we have a duty on your behalf to do. And let me just end on this point. If I was to stand here right now, just because it would be easier for me, and say, do you know what, we'll just agree to whatever the UK government has put forward. We know it's not what we were looking at yesterday, and we know we haven't done the proper assessment, and we know infection levels are different, quite markedly different now between England and Scotland, but it's much easier for me to stand here and say, yeah, you can go on your holidays. And 3 or 4 weeks from now, we're seeing a spike in infections because of the virus coming into Scotland. People would rightly be furious with me for doing that. So I need to take these decisions, the Scottish Government needs to take these decisions on a rational basis. And I've said on a number of occasions so far, this is not a popularity contest. It's about trying as best I can to do the right thing, the responsible thing, and the rational thing. And that's what I'm going to try to do. Gregory Hoare from ITV Border.
Thank you, First Minister. My question is on the cross-border cluster and is to yourself and Professor Leitch. Both today and at yesterday's briefing, Professor Leitch, you said history often tells us small clusters like this sometimes have a case where the rules haven't been strictly adhered to. I've spoken to someone from one of the affected households, which is made up primarily of NHS workers, and she is adamant that they did follow all of the rules in this household. And she says she's received a lot of abuse subsequent to that from people suggesting she may have broken the rules. So can I ask on what basis you're making that claim, and whether you think it's fair to make a claim like that when it comes to a very small cluster like this, and where even if some people perhaps haven't followed the rules, you do run the risk of tarring everyone with the same brush?
I'll hand over to Jason, but can I say nobody's pointing the finger at individuals, and no individual should suffer abuse for getting an illness. Notwithstanding what we're saying and what I'll say in a moment about the need to comply with the rules, it's nobody's fault when they become ill with a virus. But we do know, so the basis of the claims that perhaps not in 100% of cases, but in the majority of cases where a virus jumps from one person to another, one household from another, it's because there have been the bridges for it to jump across. And the Facts campaign is looking at what those bridges are and saying to people, if you behave in these ways, you remove these bridges. So in most cases where the virus spreads in the way that it clearly has within this cluster, it's because somewhere along the line, bridges that shouldn't have been there have been created, and that will usually mean that somebody hasn't at all times rigorously followed these rules. That's not pointing the finger at anybody. It's just being straight with people that we all have a personal responsibility to keep this virus at bay, because one of the things we have learned about it over these last few months, there's still, as you hear us saying often, there's still lots we don't know about it, but we have learned how infectious it is. So it will absolutely take any opportunity to spread that we give it. So we mustn't give it those opportunities, because the other thing we've learned about it is that it is a nasty virus. It can take lives of people, particularly in vulnerable categories, but we are also increasingly learning that it can leave people with other health complications. So let's break those chains and deny it those bridges, and that's what we do if we follow the advice in the Facts campaign.
I would only, and maybe I don't always ask this, but I would ask you to look back at exactly the words I said, that there is no actual evidence that I have that there were rules broken, and I haven't suggested that. What I've suggested is that often when you get clusters of 11 cases, somewhere in there, the virus has been allowed to cross from household to household. Unless all of these cases are from the hospital and from a healthcare set of infections, then that seems likely. Now, it's not impossible if you follow the guidance that the virus will spread. This virus is hugely infectious and very dangerous. So that could happen. What I'm telling you is that in most of the history of this coronavirus, usually when the rules are broken, that gets more likely. I don't know if that happened here. So let me be very clear. Nobody should be abused. Nobody should be blamed. Nobody should have to take anything on social media that it suggests they're in any way at fault. That's not helping anybody. What I'm trying to say is that we're managing this individual outbreak, one, really important. But I'm also trying to use it as an example to the country of how high the stakes are and what we should do in order to get the rewards of air bridges, of pubs and clubs, of cinemas, of all of these. They depend on us keeping the virus at a low level. That's why I'm using this story to try and illustrate that.
Fraser Knight from Global.
Thank you, First Minister. This morning on our sister station LBC, Boris Johnson told us that very good conversations have been held with all devolved nations on the air bridge topic. Now, both yourself and the First Minister of Wales, Mark Drakeford, almost at the same time, described your conversations as shambolic, the process as shambolic. So I was just wondering, is the Prime Minister lying, or has he got the wrong end of the stick? And just to be clear, when do you think you'll be in a position to tell us exactly if and what air bridges Scotland will have?
I'm not going to start making accusations about the Prime Minister. People can make up their own minds whether they take the Prime Minister's interpretation and characterisation of events, or whether they take mine and Mark Drakeford's. But I've set out pretty fully. I've not just made a claim about the lack of proper discussions. There have been discussions. I've referred to a Four Nations call earlier this week. But the proposal that we have been asked to consider has chopped and changed all along, and we've often not been given any ability ahead of these discussions to analyse the actual proposal that was under discussion. So, you know, I've set out that pretty fully, and people can make up their own minds about whether that is an acceptable basis for Four Nations discussion, or whether actually it would have been a lot better if we did it in a slightly more rational and consistent basis. And I didn't hear Mark Drakeford's comments earlier on, and certainly mine were not taken from his, and I'm sure his are not taken from mine. But if we've both independently come to the same description of the process here, then perhaps you can draw your own conclusions from that. In terms of the timescale, I said in my comments, I would hope we can complete this process over a couple of days now that I hope we have a final proposal to do that, and we'll set out our decision as soon as we can. You know, the countries are being categorised into low risk, medium risk and high risk. It is likely, although I can't say this definitively until we've completed the process, it's likely the countries in the low risk group will be relatively easy for us to come to an agreement around. It's the countries in the medium risk category that we have to give more careful consideration to, because to be blunt, in that category there is, and certainly this was true of the list, the medium risk group that we saw yesterday, there were some countries in that were lower risk than Scotland, but there were some countries that would have been higher risk than Scotland. So Scotland sat somewhere in that medium risk grouping. We'll have to look at today's list with fresh eyes to see where we would sit in that and make, as I say, hopefully rational decisions on the basis of that, and we will do that as quickly as possible. Alan Smith from Bauer.
Thanks, First Minister. Just to pick up on that last point there about making a decision on those countries, particular low-risk countries, would it be your intention then, if a decision is made in the coming days, to have this in place the 10th of July, the same day as England? My second point today was just on the mandatory use of face coverings in shops. Today I've spoken with shop workers who are genuinely worried that this will lead to confrontation with customers. Those staff have already faced increased violence and abuse over the past few months. So can you provide them with absolute clarity on what they should do if a customer refuses to wear a face covering?
It's not the role of a shop worker to enforce this. Now, I know I visited a shop last Friday, a week ago today, New Look, and the comment I'm making here was not about face coverings, because that was before we made them or announced our intention to make them mandatory. But, you know, shops are already advising customers on physical distancing, on hand hygiene, on quarantining items that they are touching. So shop workers are of course in a position of advising customers to shop in a way that is not normal and usual. And my advice to customers is to be respectful of that. And if a shop worker is saying to you, you know, you're meant to wear a mask now, then be respectful of that. It is not acceptable in any way, shape or form, now or before coronavirus, just as it will not be acceptable after coronavirus to be abusive to a shop worker. They're only doing their job, and in particular just now, they're doing the job in a way that is designed to keep you safe. But the enforcement, we'll obviously publish the regulations for this shortly, but the enforcement, the formal enforcement of this does not lie with shop workers. Enforcement would be through police issuing fixed penalty notices. As I said yesterday, this is not the easiest thing for police to enforce either, and the police can't be in every shop, in every high street, in every town in the country, obviously. But people should not be putting the police into that position either. We are asking you, with some exemptions for children and people with health conditions, to wear a face covering, because we know it is one of many things right now that if we all do, we are reducing the risk of the virus spreading. And it's a fairly small price to pay to minimise our own chance of getting the virus and to minimise our chance of passing it on to somebody who may be vulnerable and may become seriously ill with it. So please do it voluntarily, embrace it. It's not, I absolutely readily accept, it's not the most comfortable or normal feeling thing to do, although, as I say, you do get used to it as you do it more often. But let's do it as one of the many things we've been doing in recent weeks to look out for each other and to display that sense of solidarity and love and kindness to each other that I think has served us so well and actually got us to the point we are in today. So this is something we can do for each other. With face masks, you're not protecting yourself wearing a face covering, you're protecting other people, but the other people wearing them are protecting you. So it's actually one of the best examples of that spirit of solidarity and fellow feeling. So let's all do it for that reason. Tom Eden from... Sorry, your
just
second question.
Point about when you make
10th of July, sorry.
yes.
If that is possible, yes, we would obviously try to align not just on the substance but on the timing, but clearly, we have to get the assessment done first. So if and to the extent that we are aligning, then we would certainly try to align as far as possible with the timing as well. But we'll set that out in more detail once we've got to the end of our process of consideration. Tom Eden from PA.
Thank you, First Minister. Good afternoon. I wanted to ask the Economy and Culture Secretary just a bit of a follow-up about the announcement of funding for performing arts. I'm sure any money will be welcome, but for a sector that is effectively paralysed by lockdown, are you concerned that £10 million won't go very far or last for very long? And could you explain how this money is going to be used, and will it give any help to people working in the industry?
Okay, this fund is for theatres, performing arts venues, and as I announced, support and commissioning for freelancers that are associated with them. It will remove the threat of insolvency for many institutions until the end of March 2021. It will allow for specialist core staff to return from furlough and avoid redundancy, and also, as I said, help commissioning as well. In terms of volume and amount, remember, we have already moved very swiftly to help support the culture sector, and indeed, including this £10 million announcement today, that would bring to around about £30 million already the support for bridging bursaries for freelancers, but also in terms of additional support, the Open Fund from Creative Scotland, and also many of these organisations will have been supported by the Resilience Fund. So there is a long way ahead for these sectors, but if they work together and collectively, and if we can support them as well, then there is a firm future for them. But remember, there's also a responsibility for the UK government. We have shown what we can do with our powers. We don't have the same powers as the UK government to borrow billions to ensure that we have a fiscal stimulus for the economy, or indeed to support key sectors. So I think there's a real responsibility now, if the UK government really cares about culture and creativity, that they step up to the mark and help provide support. And we will certainly, from that, be able to distribute our share and help this vital part of our society, but also our economy.
Scott McNabb from the Scotsman.
So, thank you, First Minister. I just wanted to ask about the Jobs Guarantee Scheme, please. Have you got a time frame for when you would like to see that implemented, given the immediacy of the situation on unemployment, will it still apply to 16 to 25-year-olds and cover the 2-year period as was set out in the Higgins reports?
Well, I'll hand over to Fiona, but it's the recommendation that was in Benny Higgins' report that we have asked Sandy Begbie to do some implementation work around. So that's the parameters of what we are looking to, and we want that work done on as quick a timescale as possible. We will formally respond to the advisory group report by the end of this month. Fiona, do you want to say more?
I'm delighted that Sandy Begbie has taken on the responsibility to help lead Scotland, and it's a business-led response to ensure we can support not just young people, but hopefully, depending on the implementation, others as well. We'll need to wait and see what his recommendations for the implementation are. It will need everybody to step up to the mark. Yes, some public sector employers, but also private sector employers. And I think there are many people who want to be part of the recovery for Scotland, and that will be our appeal to them as well. You referred to the job retention scheme, which is slightly different, which is the UK scheme that the Chancellor is responsible for. That also will be part of a mix, and we're certainly trying to encourage extension of that, and particularly for those sectors that we know will have a longer tail in terms of being able to come back, and certainly that includes the culture and heritage sector, oil and gas. But also we need to look very hard about the impact on accommodation, hospitality, tourism. So they're two separate things. But the job guarantee recommendation came from the Economic Advisory Group report, and that's an important announcement today of our partnership with business to ensure that we can help develop an implementation plan with Sandy Begbie to help lead Scotland through this difficult phase.
Thanks. Dan Sanderson from The Telegraph.
Thank you very much, First Minister. You were clear that people flying into airports, maybe in Northern England, would still have to quarantine if there were different rules in place. But can you just explain how that could possibly be enforced, given the sort of lack of any border infrastructure? And also, people coming to the UK on holiday are probably not going to be aware of the intricacies of the devolution settlement in the UK, and might not even know that there are separate rules in Scotland. So, how could they be expected to know that if they wanted to come up to Edinburgh for a day, for example, that wouldn't be allowed? Thank you.
Well, I'm sure the media will be very helpful to us in helping set this out clearly, and I look forward to reading about it in the Daily Telegraph tomorrow. But how it's enforced, it's not about border infrastructure. We have regulations in place right now that have the rules for if you fly into Scotland right now from a country that requires quarantine, from anywhere right now that it requires quarantine, of what you have to do and how that would be enforced. So the same rules would apply, and the same enforcement structure would be around that. We wouldn't be creating something new there. That would be reflecting the law as it stands right now. Now, that would be the case if we had a different list of countries in Scotland to England. I hope we can avoid that. But in order for me to know whether we can avoid that, I've got to have the ability to assess the UK government's list for England and make a judgment about whether that is a reasonable risk for us to be taking in Scotland, and we will do that as quickly as possible. And part of the reason I stand here every day and give this briefing and answer questions is because I want people to understand the decisions we're taking. I want people, whether they agree with those decisions or not, to have an insight and an understanding into the thought processes and the factors that we are taking into account in coming to these decisions. And also I want people to develop an understanding where there are differences between Scotland and the rest of the UK, why there are those differences and what those differences are. And as I say, the media, while it's my responsibility to explain Scottish Government policy, of course the media have a role to play here in making sure that where there are differences, they are set out in any reporting, not in a value judgment way or in any way saying that these differences are right or wrong, but just in a factual public information way, I guess. Alistair Grant from the Herald.
Hi, thanks very much. Just to follow on from that question, would this require border control in an airport down in England to notify Police Scotland when someone flies in and has the intention of obviously going home to Scotland after that? And I think, if I'm right in saying that Police Scotland a couple of days ago said that at the moment they have trouble enforcing this because they're not notified of breaches. So is this effectively self-policing in a way, just relying on people's honesty? And if I could just ask as well quickly, Obviously, beer gardens are due to open on Monday. Do you have any last advice for Scots that are planning to go out for a drink? And are you planning to go to a beer garden to mark the occasion yourself?
I'll come on to that in a second. This does not require border controls or border posts. Basically, the arrangement we have right now around the rules on quarantine and the enforcement of quarantine would apply to somebody coming from another country to Scotland via England, as it would apply to somebody coming to Scotland from another country directly. So exactly the same arrangements that apply now in that situation would apply in that situation as well. And none of the issues that we're talking about right now are straightforward in terms of enforcement. There are enforcement rules around many of these things, but none of them are straightforward. The situation we're dealing with right now is not an easy one, and it's got all sorts of unprecedented difficult issues attached to it, which is why we do, even in areas where there is regulation and enforcement, we still say to people, just as I have been on face coverings, do it for the right reasons, because none of these rules or restrictions are being put in place right now because we want to make people's lives difficult. They're being put in place because they are judged to be necessary to protect people from the virus. So they're in all of our interests. I actually visited a beer garden this morning to see their preparations, not to socialise, I should say, because they're not open officially, but just as I did last Friday with New Look ahead of them opening, I went to a beer garden in Edinburgh this morning to look at the measures that had been put in place to keep customers safe. I was very impressed with that. I was very assured actually by what I saw there from the way in which customers will be greeted, and they had a QR code that would allow them to collect the details of customers through to the hand sanitising that was on display, the signage giving people safety advice, perspex screens had been erected in parts of it as well. So it was a very good example of really good practice. And my advice to beer gardens opening is that, well, firstly, I think it's good to see hospitality start slowly to get back to normal, but there's a long way to go in this, and so take care to make sure you're protecting your customers, because a key part of this is giving the public confidence to start going back to places. And if people, when they go to somewhere like a beer garden, they feel safe and they feel that the business owner has taken the right steps to keep them safe, then they're more likely to go back, and they're more likely maybe to tell other people that it's safe to go. So again, there's a really strong collective interest here in all of us trying to get this as right as possible. And maybe sometime next week I'll get to go to a beer garden for a more sociable reason, but I have no firm plans on that front at the moment. Mark McLaughlin from The Times.
Hello, First Minister. I'm still not clear on the air bridges plan based on what you just said there. So if Scotland objects to a medium risk country, will that mean that Glasgow and Edinburgh airports will be forbidden from taking in passengers from that country, and do you even have the jurisdiction to do that? Or will they be allowed to take passengers in as long as those passengers then go in quarantine, flying into Scotland and quarantine, just the same as they would be asked to do from Newcastle?
It's the latter. So the UK government's proposals here are about lifting the requirement to quarantine. So if Scotland decided, and again, I'm being hypothetical here because we haven't taken this decision, and I don't want, if we can avoid it, to get into the position of there being a difference. But I'll try to make this as clear as I possibly can. So if we decided that there was a country that England thought was safe to allow its people to travel from into England without quarantine, if we decided we didn't think that was safe, then people could still come from that country, but they would still have the requirement, if they flew into Scotland directly, to quarantine. And if they came from that country through England into Scotland, they would have the requirement to quarantine here. So the difference would not be whether people are allowed to come or not, it's whether they would be required to quarantine while they were here. Of course, there's a reciprocal element to this debate as well. Once we've had the chance to look at the list the UK government have appear to have settled on today, we will see what the reciprocal elements are. But some of the the countries on the list yesterday, as I understand it, although the UK was considering allowing people to come into the UK without quarantine, there wasn't a reciprocal agreement to allow people from the UK to go to those countries without quarantine. So there's reciprocal issues here as well. But just to be clear, the issue is about the requirement to quarantine. It's not about barring people coming altogether. Tom Peterkin from the P&J.
Good afternoon, First Minister. On the same issue, Derek Provan of Aberdeen and Glasgow Airport has warned that a piecemeal approach on travel will compound the devastating impact of a blanket quarantine has had on aviation, tourism and hospitality. He also says that people are fearful for their jobs. Is this something you feel you must take heed of and sort out this situation as soon as you can?
I think I've probably made clear a few times the rational process that we will go through here as quickly as possible, so I won't repeat all of that. I absolutely think that issues of economic impact, viability of airports and airlines and the aviation sector generally, of course these are factors we have to take into account in all of this. You've heard me talk before, right way back from the time we first published the paper about how we would eventually come out of lockdown, about the 4 harms: the harm from the virus, the economic harm of tackling the virus, the health impacts of some of that as well. So we take account of all of these things. I had a roundtable discussion earlier this week with the aviation sector. Derek Provan was on that call. I absolutely understand and make no criticism of them for this, that if you're the MD of an airport, you're absolutely prime consideration is the business that flows through your airport and the airlines that fly from your airport. I absolutely understand that. That's not an insignificant factor in my decision making either. But as First Minister, I've got to take account of all of the different issues that we need to get into the right balance. And of course, right up there for me is public health. Are we taking decisions that are consistent with keeping the virus under control, or could some of these decisions risk the virus running out of control again? So I have to take account of all of the different factors and try to reach the right balance. So public health, absolutely, but the economic impact of all of these decisions is in there as well as part of the consideration. Rachel Watson from the Daily Mail.
Thank you, First Minister. Sorry, can we just go back to air bridges again and quarantine? And can you just be clear who would, if there was different approaches, who would be in charge of enforcing those quarantine rules, whether people come up from England having flown into airports there, or if people fly into Scottish airports? Because is it not currently Border Force who do this? So would it require an agreement with the Home Office if Border Force were to continue doing that? And also, can you name some of the countries that you have specific concerns about?
I'm not going to start naming countries right now. We'll go through a proper assessment, because this is not about, just as we were talking earlier on about individuals in clusters here, it's not about blaming people. It's taking a rational, hard look at levels of infection and therefore the risk that flows from that. And that's what we'll do. And it's not a reflection on the individual countries concerned, just as those who are well, undoubtedly there will be some in the category that continue to attach quarantine arrangements to passengers from the UK going into their countries. That's not a reflection on the UK. So let's not turn it into that kind of debate. Some of these questions that I'm being asked just now, and I will answer them, but can I make a helpful suggestion that a lot of the answers to these questions lie in the regulations that are currently in place and in force and operational in Scotland right now. So the responsibilities of Border Force and the responsibilities of the police and the public health arrangements we have in place around this. So some of the answers are there, because it would work as it in a future scenario that you're talking about, the same as it already works right now. So if somebody was coming into an English airport and coming to Scotland and we had a different list in play, they would have to quarantine here. The Border Force would continue to do what they do at the English airport, and the enforcement would be as it is anyway in Scotland right now. People coming into Scotland, yes, Border Force would continue to have a role to play there, and if we are in this situation, we'll discuss that with them. But, Border Force is a UK-wide organisation, and I'm not sure the UK government is, and I'm certainly not sure they should be suggesting that it wouldn't operate in a way in Scotland that reflected the law in Scotland. I think that would be a rather bizarre and an unfortunate position to be in. So let me go back to basics here. I'm not trying to seek divergence here. I want to align as much as possible, but I want to make sure that the decisions I take are not putting Scotland at risk of the virus running out of control. So I need to take these decisions properly, carefully, rationally, recognising that whatever decisions we take, some people will agree with them and some people won't. But as I keep saying, it's not a popularity contest at the moment. It's about keeping Scotland safe. That is my, and the whole Scottish Government's principal responsibility right now. Andy Nicol from The Sun.
Good afternoon, First Minister. On the question of beer gardens, if we go to a beer garden next week, can we go into the pub to use the toilet?
The toilets, there was guidance published, I think, at the weekend on public toilets. Beer gardens will be, it's a bit like if you go to somebody's garden right now, but you're not allowed to go in the house, we allow you to use the toilet. But the cleaning arrangements around these arrangements are very important as well. So all of that is set out in guidance, and if you are in a beer garden next week, and I have no idea whether you will be or not, what I would ask you to do is familiarise yourself with all of that guidance to make sure you're sticking to the rules as you go. Derek Healy from the Courier.
Thank you, First Minister. Just to touch again on the comments from yourself and the Welsh First Minister on, as he put it, utterly shambolic experience of dealing with the UK government on air bridges over the past few days. It's not the first time we've heard you and other leaders describing these kind of difficulties. And I know it's a worry for businesses to have uncertainty hanging over these big announcements. Has there been a breakdown in communication between the UK government and the devolved administrations during this pandemic?
There's not a breakdown in communications, no. I absolutely would not describe it as that. But there is very often a frustration on the part of myself, Mark, and indeed the Arlene and Michelle in Northern Ireland, although I don't speak for any of them, about a lack of communication, and where we have communication, that communication sometimes takes, I'll characterise it in this way, often the UK government's attitude to Four Nations discussions appears to be that they make the decision and the other three nations just come along to rubber stamp the decisions, and that there's not actually a proper, on the basis of equality, recognising our respective responsibilities and duties, a proper discussion based on shared evidence and information, and then an agreement that we come to a decision collectively and it becomes a Four Nations decision, or for good reason, if we can't come to a Four Nations decision, we respect each other's different opinions. So there's not a breakdown of communication, it's just the form and nature of that communication sometimes doesn't enable it to be as meaningful and as conducive to agreement as we think it should be. I speak to Mark Drakeford regularly, as you know. I've not spoken to him in the last couple of days over this in particular, although our governments will have been in touch. And I have not spoken to him before describing the UK government's process around this as shambolic. So the fact that both of us, completely independently, without any reference to each other, have described it in the same way, if I was, if I can get myself into this headspace, if I was the Prime Minister right now, I kind of would look at that and think, maybe it's not all their fault, maybe there's something here about how my government is operating that I should take a look at, and I hope the Prime Minister might reflect on that. And lastly today, Terry Murden from Daily Business.
Good afternoon, First Minister. Just a couple of things. Firstly, following on from the various reports we keep getting on the economy, how soon can we expect a firm plan of action? And will you start by giving a commitment to some of the unfinished projects that we still have around? The second thing is
do you want to give an example of those?
Yeah, like the sort of hospital buildings and road buildings and all that sort of thing. Will you be saying that you will get on with it?
Give me one. I mean, obviously different projects will be at different stages of development and completion. So if there's a particular project you want to ask me about it.
Well, I've just mentioned a couple. There are
But
various
you didn't.
projects.
But hospital projects is a generic thing. Road building projects is generic. If there's a
This is what
project you think is not being completed on time, ask me about that project and I'll answer or get you the answer to that question.
Okay. Will you commit to an infrastructure project, put it another way, that will actually see some firm shovel-ready projects completed?
So on your first question, and I think you were on the call when Benny Higgins was here, so the timescale of when we will turn these reports into an action plan, we said that day, and we've said several times since, that we will have our response to Benny Higgins' report by the end of July. So we have been very clear about that. We have, in terms of a capital programme with shovel-ready projects, we have already announced, just, 2 weeks ago, Fiona, a £230 million capital stimulus programme. Construction on hospital essential projects never paused over the course of the virus, and of course construction is now quickly getting back to normal. If there are particular projects you want me to comment on, I'm happy to do that, but just a generic, when our project's going to get back on track is a bit vague for me to do that properly. So my apologies for asking you to be more specific, but that's the reason, and we will continue to look for ways in which we can accelerate capital projects, which during any economic crisis we know is a really important way of trying to create jobs and protect jobs. Fiona, do you want to add?
Yes, it was several weeks ago that we announced an economic stimulus to support the restarting of the economy. Clearly, construction has been back for some time in Scotland, but we're also looking at projects that include the following: regeneration projects affecting different parts of the country. Yes, there's some road building in that as well. We're also supporting construction companies with a £100 million loan to help small and medium companies to accelerate their work. We, as part of that £230 million announcement, we announced £62 million of an energy transition fund, particularly helping the North East. We helped identify restart for small companies that are high growth but emerging companies, and also some digital projects. So we're already starting our stimulation of the economy using capital and infrastructure, not too dissimilar to what the UK government announced on Monday. But of course, there's no consequentials from what the UK government announced at the beginning of the week. What we really need, and what we'll be expecting to see from the UK Chancellor next week, is a real level of fiscal and economic stimulus, similar to the levels you've seen, for example, for Germany, where you've seen 4% of GDP, which would see an £80 billion economic stimulus to kickstart the economy. We have never seen an economic crisis like this, so therefore it needs that level and of response. We will do what we can, but we expect the UK government to step up to the mark.
Okay, thanks. My thanks to all the journalists for joining us today. That concludes all of the questions. My thanks to Fiona and Jason and Rachel, our BSL interpreter today, and thank you to all of you. I will leave you just with a reminder of my plea to you every day. As you start to go out and about a bit more, as you start to introduce more normality, not complete normality, I hope, into your lives, think about how you do that safely. And the ways to do that are the 5 key measures in the Facts campaign that we're asking you to rigorously abide by. Face coverings in shops or public transport. Avoid crowded places, even if those crowded places are outdoors. If you turn up somewhere and it's crowded, go away and go somewhere else. Clean your hands and clean any hard surfaces that you touch. 2 metres distancing, remember that is still the rule, and self-isolate and book a test immediately if you have symptoms. If all of us abide by these 5 measures, then we will reduce the risk of this virus getting out of control again and getting a grip on us again, and that will mean we can introduce more normality into our lives, I hope, sooner rather than later. So thank you all very much for joining us today. We will be back here on Monday at the normal time of 12:30. In the meantime, have as good a weekend as you can in these strange circumstances, and for Sunday, happy birthday to our precious and cherished National Health Service.